Greetings. My name is Dr. Alexander Egbe, a congenital cardiologist and an assistant professor of medicine and pediatrics at Mayo Clinic. I'll be speaking about the role of anticoagulation in Fontan patients. In the first part of this talk, I will discuss the different types as well as the risk factors for thromboembolism in Fontan patients. Thromboembolism is a medical terminology for blood clots. In the second part, I will discuss the different treatment and prevention options for thromboembolism. Thromboembolism or blood clot can affect any organ system in the body. If the blood clot occurs in the brain, it will result in a stroke. If it occurs in the small blood vessels in the lungs, this will cause pulmonary embolism. Blood clot in the coronary arteries will result in myocardial infarction or heart attack. It can also affect any organ in the belly, such as the kidney and the bowels. In the Fontan patients, most times the blood clots originate either inside the heart or somewhere inside the Fontan connection. But rarely it can originate in the calf, a condition known as deep venous thrombosis or DVT. Fontan patients have a higher risk for blood clots compared to the general population, and this is because of certain risk factors found in this population. The first risk factor is sluggish blood flow, either inside the heart or within the Fontan circulation. And this is more common in the patients with the old style Fontan known as the atriopulmonary Fontan. The second risk factor is arrhythmia, which is abnormal heart rhythm, which is also very common in this population. The liver is responsible for forming most of the protein required in the regulation of blood clot in the body. Liver cirrhosis, which is an advanced form of liver disease, currently affects about 1/3 of Fontan patients. And these patients lose this ability to perfectly regulate the blood clotting mechanism in the body, hence increasing their risk for blood clot. Finally, some patients just have genetic predisposition to blood clots. All these factors, individually or collectively, overall increases the risk for blood clot in Fontan patients. So we've had an overview of the different types of blood clots and the risk factors for blood clot in these patients. So the question is, can we do anything to prevent this? The answer is yes. We can prevent thromboembolism or blood clots, and the options are either using aspirin or warfarin, also known as coumadin. Before deciding on the medical therapy, it is important to carefully analyze and balance the risk for clotting versus the risk for bleeding for each patient. Most Fontan patients are placed on aspirin because we believe that it has a lower bleeding risk compared to warfarin. In a recent study from the Mayo Clinic, we show that warfarin is safe and effective for preventing and treating thromboembolism in Fontan patients. I would like to draw your attention to the right side of the screen, and you will see that the patients who were taking aspirin alone had a higher risk of having blood clot compared to those that were taking warfarin, as shown in red. Also, on the left side of the screen, you will also see that the patients that were taking aspirin alone had a higher risk of death or being hospitalized compared to those that were taking aspirin, as shown in red. So this study shows that warfarin is superior to aspirin in preventing blood clot. So the next question is, should all Fontan patients be on warfarin? The answer is no, because warfarin has its own side effects, as I will show in the next slide. The patients that should be on warfarin are the high-risk patients, which include those patients with atriopulmonary Fontan, which is the old-fashioned Fontan operation that was done in the 1970s and 1980s. Those with arrhythmia or abnormal heart rhythm, and patients who have prior thromboembolic events or blood clot. These are the patients that should be on warfarin. In the patients who don't have these risk factors, the decision to give aspirin or warfarin should be individualized and made on case-by-case basis. The use of warfarin is associated with increased bleeding risk, and also the patients have to get routine blood tests known as INR to monitor the effect of warfarin as long as they are on this medicine. Also, warfarin interacts with a lot of medications and food products such as green vegetables and salad. In summary, the take-home message for this talk are: Fontan patients have increased risk for blood clots, and this risk is highest in those patients with atriopulmonary Fontan connection, which is the old-style Fontan, patients with abnormal heart rhythm, and those that have had prior blood clots. Warfarin is safe and effective for preventing this complication. Unfortunately, it is associated with some problems such as bleeding, the need for routine blood tests, and the problem of interaction with other medication and food products. It is important for you to work alongside your congenital cardiologist to analyze your risk and decide on the medical therapy that will be best for you. Thank you for listening, and I will encourage you to email your questions and concerns to me.